Hello everyone, my name is Krishnakant Shukla and I am making the clinical questions videos. So in exams we have to solve the clinical questions. So I will be trying to solve as many as the important questions that are asked in the MHS exams. So today I have came with the type 2 diabetes mellitus. So before starting this topic, I just want to say one thing, that in my last video I discussed the rheumatic disease, and in that I forgot to say one thing, that in SLE or any rash or any skin problem, we mostly provide the patient with the vitamin D3 because the sun rays cannot penetrate the skin. So that's why we have to give a supplement of the D3. In SLE, we also have to give the patient the sunscreen. Okay, so starting with this question. A 48-year-old obese male present with excessive thirst, increased urination and increased hunger. What is this? Poly. You say me. Okay, I'll say you. Increased hunger is polyphagia, more of eating. Increased urination, polyuria. And excessive thirst, polydipsia. Okay, so these three things are a triad for the diabetes mellitus. Okay, it means more of increase in glucose in body and weight loss for 4 months. Okay, means because of increase in glucose, and that is not being used in the body because maybe insulin deficiency or anything. So there is no use of the glucose. So that's why body uses the fat stored in the muscles and visceral body fats. Okay, so that's why weight loss has been happening over here. He has a family history of diabetes, so it's very obvious it is a diabetes patient. And sedentary lifestyle means it's a risk factor. Okay, so on examination BMI is this much and BP is very most high only. Okay, so most likely diagnosis we all know, that is diabetes mellitus. On classification we have to see about the investigation. Before starting this, I have to say few important things over here. Investigation, what WHO says, patient should have fasting blood glucose sugar of more than 126 mg per deciliter and RBS of more than 200 mg per deciliter with signs and symptoms. Okay, and HbA1c is more than 6.5. HbA1c can tell about the glucose for past 3 months. Okay, that is of more important. So this should be present. If symptomatic patient is there, any one of the above features is required. Okay, and if asymptomatic, we need only 2. At least 2 is needed for saying that a patient is diabetic. Okay, so in there is a triad of polyphagia, polyuria and polydipsia. And also in diabetes mellitus, mostly what happens due to increase in glucose, so we can say that the blood gets mostly thickened, like sugary syrup how is thickened जैसे हमारा चाशनी होता है, वैसे ही हमारा ब्लड थिक हो जाता है. उसकी वजह से क्या होता है, ब्लड फ्लो रुक जाता है. सो मोस्टली पेरिफेरल ऑर्गन्स आर अफेक्टेड, मोस्टली द ब्लड सप्लाई टू द नर्व एंड अफेक्टेड. सो दैट कॉज द न्यूरोपैथी, मतलब कि नर्व डैमेज हो रहे हैं क्योंकि उनको ब्लड सप्लाई नहीं पहुंच रहा, तो ऑक्सीजन नहीं पहुंच रहा, तो वो डैमेज हो जाते हैं क्योंकि इश्केमिक हो जाते हैं वो. ठीक है, इन्फार्क्टेड हो जाते हैं वो. Same goes for the coronary blood supply or heart blood supply. That happens due to the decrease in blood supply. तो उसकी ischemia होगा. ischemia की वजह से क्या होगा, MI आ सकता है उसको. Okay, so arterial disease happens, we have MI. And in peripheral body parts, foot and hands, you can see that patient have diabetic foot. Okay, what diabetic foot? Because of decrease in blood supply, there is ischemia, then it goes to the gangrene formation. Okay, so to prevent the MI, we give the patient aspirin. Blood thinner है, ठीक है. Okay, so what are complications? What will be the complication due to the decreased blood supply? This complication will happen. So microvascular complication due to microangiopathy and macrovascular due to the macroangiopathy. Okay, so here answer is type 2 diabetes mellitus. What are the types of classification of diabetes? You have to read this from the Bulur. Okay, or any other book you want. There is type 1 diabetes, type 2 diabetes, gestational. There is also type 1.5, and there are many researches going on over here. Okay, secondary diabetes. And what will the one confirmatory that I told you? Okay, complications, microvascular complication, what are retinopathy, nephropathy and neuropathy. Where blood supply is reduced, that pathy happens over there. Okay. So, and microvascular means major blood supply are affected. Coronary artery disease, stroke, peripheral vascular disease, that is gangrene. It's a very simple thing that you can apply logic and you can understand and keep in memory. Okay. So, first line drug is metformin. Okay. One more thing, that drugs that we give to patient, here the patient is obese. Okay. Here patient is obese and sedentary lifestyle, patient is obese. Here BMI is given of 30. So the mainline drug over here is metformin, because metformin given in obese patient, and also this patient you have to give this can cause vitamin B12 deficiency. So along with that we have to give the vitamin B12. Okay, this can also cause diarrhea also. Okay, and what if the patient is not obese? You can give here enhancing the insulin secretion by what drugs? You can give sulfonylureas. Okay, sulfonylureas is given in the non-obese patient. Okay, so moving to the next question. And also lifestyle modification in diabetes patient, mostly doctor says instead of taking the drugs or insulin shots, you have to do the lifestyle modification. In what? You have to do the exercise, you have to do the resistance training. In what this happens, by doing the exercise, our muscle increases the sensitivity to the insulin, so body uses the insulin in a very effective way. Okay, so we have serious problems over here. And also what we should ask the patient in lifestyle modification, what are the goals over here? You have to ask the patient to reduce the weight, have to achieve a good glycemic control, and also decrease the risk of the complications over here. You have to avoid the injuries. Okay, you have to avoid the hyperglycemia, you don't have to eat sugary foods in empty stomach. Okay, and also you have to avoid the monosaccharide that are easily absorbed in the body. Okay, you have to eat the low calorie diet, you have to take the protein. Okay, and also one thing, when there is a diabetic nephropathy, you have to take low protein diet. Okay, low protein diet, that you have can ChatGPT or Google, or you can read from the book. It's very interesting concept. Okay, also dietary fiber should be used, because you have to stop the hyperglycemia. Okay, ज़्यादा absorb हो जाएगा अगर dietary fibers नहीं खाएंगे तो फिर जल्दी absorb हो जाएगा. And you have to stop the alcohol. Okay, everything alcohol is happening. Okay, so weight reduction and exercise you have to do, and these are the triad. You have to keep this in mind. And also these are some extra questions I have put over here that are not asked. So these are some extra questions that I have added over here. Okay, so you have to use the insulin therapy over here. So after this, the most important question for MHS exams for clinical questions are the diabetic ketoacidosis. What happens in diabetic ketoacidosis? The name says, because of the increase in the ketone bodies, there is acidosis. What are ketones? Ketones are acidic. Ketones are acidic. So, and also in this there is H plus rise. Just easy to remember, this ketone are acidic. So patient will have what? Because patient is getting acidic, increase in CO2 happens. So to flush out the CO2, patient gasps. Patient not gasps only, it rapidly breathes to remove the flush the CO2 out. So rapid breathing occurs. Okay, so just let's start this question. 22-year-old patient present with a vomiting. Okay, abdominal pain, dehydration, deep rapid breathing, and breath smells fruity. Because of the ketones, the breath smells fruity. Just saying by reading this question, reading this point, you have to understand this is diabetic ketoacidosis. Just we should understand this, why this thing happened, why is vomiting happening, why this abdominal pain happening, why dehydration, and why deep rapid. I told you this. Okay, so why dehydration and abdominal pain and vomiting? So this is a medical emergency due to severe insulin deficiency. Most common occurs in type 1. In type 1, all the beta cells are destroyed. That's why there is no insulin secretion. So there is no insulin. So rise in glucose will happen, and due to this, increase in the osmolarity of the blood. Okay, so due to a increase in the glucose, the kidney tries to remove that glucose. Okay, so because of that more of the water is also removed. ऐसे तो निकाल नहीं देगा ग्लूकोज, उसको मिला के करना पड़ेगा किडनी को. सो पॉलीयूरिया हैपेंस बिकॉज it also takes water, lots and lots of water. Patient gets dehydrated, so because of that polydipsia also occurs. Okay, dehydration and abdominal pain and vomiting. Abdominal pain you can just google it, this is not much question. भूख लगती है तो फिर वैसे भी पेन होता ही, वैसे भी ऐसे मैंने याद रखा था इसको. Okay, and vomiting due to the increase in ketones it affects the CTZ. What is CTZ? It is center in the brain that triggers for the what? Vomiting center. Okay, so and why there is no usage in the there is a rise in glucose, but glucose is not used because there is no insulin. So glucose cannot enter the cell will think that there is no glucose, you have to eat more, so more of the growth hormone release, more of the cortisol release, because of the patient eats more and more. Okay, so these things are not much of important because in medical emergency there is a vomiting, abdominal pain, dehydration. Okay, and there is a rapid breathing. So this is an emergency case, you have to treat immediately. Okay, first, but there are some things that you have to check over here, how to diagnose this patient. Okay, here the diagnosis is ketoacidosis. Because of the increase in ketone, this is acidic, so it is metabolic acidosis. Okay, and Kusumal breathing occurs over here. Kusumal breathing is rapid deep breathing. Okay, and one precipitating factor, because insulin is not there, and there is also rise in glucose. When the insulin reduces, when it will reduce in case of any infection, infarction or secondary infection, stress or any surgery, that causes rise in glucose. Okay, and also causes the because of rising glucose due to the insulin deficiency. Okay, so patient is dehydrated, so you have to give the IV fluids of normal saline. Okay, first you have to take the patient to the 250 to 500 ml. Then you have to take the patient comes to the 250 milligram per deciliter of the glucose. Then we have to reduce it by stage. You can read this in the book. Okay, and also I taught you this. What is the diagnostic criteria over here? The arterial pH acidic मतलब 7.3 से कम होना चाहिए. Serum glucose means more than 250 because it is severe insulin deficiency, so increase in the glucose. Okay, and it is here serum bicarbonate decreases, acidosis है ना, तो फिर base कम हो जाएगा. And what is HAGMA hagma? What is this? High anion gap metabolic acidosis. Patient also has ketonuria and ketonemia. Okay, simple. One more thing, there is insulin deficiency, so we have to give the insulin. But before giving the insulin, just check for the potassium levels. Because of the hyperkalemia, here patient may have cardiac arrhythmia. If you want to another video for the metabolic acidosis and those fluid and electrolyte things, I have many of the tricks over here so that I can teach you. If you want that video, just comment down, I will make the video. Okay, and many questions came. In surgery we had hypokalemia, in medicine we have hyperkalemia, so these questions are very common in medicines, pediatrics and surgery also. Okay, so this is metabolic ketoacidosis. Okay, so what we have to do here, the testing what we have to do here, we have to check for the ECG also here. Okay, patient को MI तो नहीं आ रहा है. Same thing, insulin deficiency, it is diabetes. Patient may have cardiac abnormalities. Okay, there are few more questions over here that you can solve over here that are same that I have told you. Okay, what are the 4 pillars of management of the DKA management? That is IV fluids देना है हमें, insulin infusion देना है, पोटेशियम करेक्शन करना है हमें, और ट्रीट द कॉज, क्योंकि स्ट्रेस की वजह से वो इंड्यूस हो रहा था ना, वैसे भी इंसुलिन डिफिशिएंट तो है पेशेंट को. ओके, व्हाट इज HHS एंड DKA? व्हाट इज HHS? hyperosmolar hyperglycemic state. Okay, hyperosmolar hyperglycemic state. And what is DKA? diabetic ketoacidosis. What is the difference between two? You can tell me, but I will tell you the simple thing. In HHS there is increase in the glucose. Here also increase in glucose, but here glucose is not being used. Here use हो रहा है थोड़ा थोड़ा, ठीक है. यहाँ पे ग्लूकोज यूज़ हो रहा है, इसलिए यहाँ पे फैट का यूसेज नहीं हो रहा है, यहाँ पे फैट का यूसेज हो रहा है. यही फ़र्क है इन दोनों में. ओके okay. Some few more important questions that have been asked in my exams and PYQs that I will telling over here. That is metabolic syndrome का case. What is metabolic syndrome? इसमें patient has obese, patient is cardiac patient because of the increase in HDL, high density lipid, okay, and patient is of hypertension and dyslipidemia, ठीक है. तो इसमें डायबिटिक होता है पेशेंट, ओबीस होता है पेशेंट, उसको सीवीएस का रहता है क्योंकि उसको उसका कोलेस्ट्रॉल हाई रहता है इसी वजह से, ठीक है. Okay, there are more questions over here. These are the complicated questions. Means complication of the diabetes, that type of question. Okay, you have to read this. Okay, all the complications that are important. In other university that they have asked that what are the complications for the skin complications of the diabetes. Okay. One more thing here, very important. In diabetic patient they get MI. In MI we have learned that the pain starts retrosternal pain होता है that travels to the hand, but in diabetic patient this pain doesn't occur. Why? Because of the diabetic neuropathy. In neuropathy, nerves are damaged, so no pain transmission occurs to the brain, so there is no symptoms of the pain. Only the patient will present with the sweating, nausea. Okay, so this is silent MI. That's why we have to do the ECG in every diabetic ketoacidic patient. Okay, and also ECG tells about the potassium levels. How? You can Google that, and everything you have to read over that. Okay, and in video of the hyperkalemia, I will tell you how the potassium changes are shown in the ECG levels, where tall T waves occurs, where U wave occurs, where QRS ST is inverted. Okay. So this is the end of the video. Thank you for very much.